How we doing? We ready? Okay, great. Thank you. Good afternoon. I want to thank you all for being here with me today. I'm joined by the Secretary of Health, Kim Malzum-Risden. I wanted to give you a quick update on how the mass testing event is going down in Sioux Falls. Yesterday was day 2 of the operation, and they completed approximately 1,100 tests. If you combine that with the 1,500 tests approximately that they did the first day, we have about 2,600 people that we have pulled samples from and should be seeing those results trickle in the next 24 to 48 hours. I really do want to thank Avera for all of their hard work, our Department of Health employees that are down there staffing the event, as well as the National Guard and the CDC. They've all just been absolutely fantastic. And I want to remind everybody that given this testing that we're seeing, we expect that this will drive our case numbers up. So I want to prepare everybody that as we do more and more testing in a community where there is already community spread, we do expect to see a big increase in positive cases. Let's remember, though, to keep our focus on hospitalization rates. I need people to be smart, continue practicing the physical distancing, washing your hands, and remember that we are in a marathon. This, again, is not a sprint. We have a long ways to go. I do want to especially thank the language specialists that have been down there. They have been fantastic. They were there all day and invaluable, and we really appreciate all of their hard work. Last night I hosted a phone call with all of our legislators and talked to them about some of the questions they're hearing in their communities. And that was a great conversation, not just about COVID-19 cases in the state and hospitalization rates and projections, but also we talked about revenue numbers, and then we talked about some of the business challenges that they're seeing in their communities as well. So I want to appreciate their continued engagement and their willingness to get on those calls, because they help me communicate with those local communities each and every day, are really our ambassadors for making sure that we're all on the same page as to what the facts are on the ground. A few thank yous that I want to touch on today. I want to thank the South Dakota National Guard. I don't know if everybody realizes every role that the National Guard is filling for us here in South Dakota these days. They are staffing at our Emergency Operations Center. They have stood up 2 alternate care facilities in Sioux Falls and in Rapid City. They have 25 ambulance teams that are ready, 21 ground teams, but they also have 4 air support teams. Their training for medical capability teams was completed yesterday, and they have those capability teams ready to go when we should need them. They have call centers helping with contact tracing in Sioux Falls and Rapid City, and they're willing to help expand those if needed. And they also have contingency plans in place if we need help with food distribution, and they are ready to go at a moment's notice. We knew they would be ready, they always are, but I don't want anyone to take for granted how blessed we are to have men and women in our South Dakota National Guard that continue to step up and take care of people and go above and beyond to make sure that they're continuing to serve in every role that they're in. We also have National Nurses Day today. Our estimates show that we have more than 10,000 nurses working in South Dakota, including more than 350 that work specifically for our state government. We're so thankful for every single thing that they do to keep our state healthy. They're just really every day taking care of individuals, leaving their families. And I had a conversation with a nurse just last week that had been in isolation for 14 days away from her small children because she worked in an OB ward, but she didn't want to spread the virus outside of the hospital. And those kind of sacrifices that people are making, we just many times don't point to and recognize the real service that they're giving to South Dakota. Especially in a time like this, when they're working the front lines, we just want to pause for a minute today and to say thank you. This is also National Travel and Tourism Week. Now, things are a little bit different in South Dakota this year for Tourism Week. There's usually, now is when we're prepping all of our visitor centers for people all around the globe who choose to make their vacations and spend their time in South Dakota. But I want all of those in the tourism industry to know that we're thinking about you. And now more than ever, our friends in the tourism industry need our support, they need our encouragement, and they also need us to talk about them and encourage people that when this virus is over, that South Dakota opens its arms and welcomes visitors to come see us and experience the wonderful state that we have the blessing in to live in every single day of the year. This year's theme for National Tourism and Travel Week is called The Spirit of Travel. So I'd invite you to jump on tourism's website and see all that they have to offer as it relates to a virtual tour right now. South Dakota tourism is resilient and it's important to our state. So to everyone in South Dakota working in the tourism industry, thank you so much. With that, I will open it up to any questions that you might have.
Governor, Bob Mercer, Kilowatt News. Are you opening, or is the state of South Dakota opening the visitor centers along the interstates?
I believe that they're not open as of yet, and we'll continue to do an analysis on if we can do that. But no, those are areas where typically people would share germs and congregate in larger quantities of individuals. So we're hoping to keep those closed to slow down the spread for a while yet. Questions on the phone?
This is Jody Heemster at Dakota Radio Group in Pierre.
Sure, go ahead, Jody.
Just wondering an update on state workers returning to their physical offices, especially obviously here in Pierre where there's the bulk of the state employees. No, you said you had a cabinet meeting Friday and we're leaving things up to your individual cabinet members to work with their departments. Just wondering kind of where we're at, what the status of that is.
They are moving back into their offices in phases. So we have each agency and department, it's doing an evaluation on which employees could come back in and if they will be there full-time or if they'll stage them a few employees for 1 or 2 days a week and then switch them out. So it's hard to be specific because every agency is handling it differently, although I know many of them are anxious to get some employees back into the office so they can take care of the day-to-day tasks that they would be anxious to accomplish in an office setting. In those office settings, though, I want to be clear, they will physical distance. They will make sure that their desks and tables and their workspaces are spread out, and they will continue to make sure that they're washing their hands and practicing good hygiene while they're at work. So the cabinet secretaries all are doing an evaluation on what that looks like for their agencies and are ready to implement that. And I know many of them have even started that process this week.
Will employees continue to work remotely as well in some combination with this?
Yes, some will continue to do that. We have very little administrative leave that's still going on with state employees, which is good. It means that they've moved technology to home. They're able to do their work remotely, and that's been very helpful to make sure that we're still serving the people of South Dakota with their needs.
Thank you.
Governor, this is Stephen Groves, Rampy.
Sure, go ahead, Stephen.
So your office sent a note to the media yesterday calling one of our AP stories from earlier in the week inaccurate. I was wondering what you felt was inaccurate about the story.
Well, there were several things that were inaccurate in the story. I think it's important that when you're writing a story, it's good to use individuals that will go on record stating the facts that were in there. Using anonymous sources is hard to maintain credibility when you're talking about situations. And there was several items in there that were very hard to find information in reality.
Was it inaccurate that Corey Lewandowski advised you and visited Pierre as part of that role?
He did visit Pierre, but I have many people that advise me, and I'm also an independent woman who makes decisions on her own after learning the facts and information given to me. So to say he has undue influence over me would be wrong.
Thank you.
Governor Lee Strubinger, SCPB.
Yes, go ahead, Lee.
I was wondering if you could talk a little bit about the restrictions on the $1.25 billion federal dollars. I guess what can the state do with that money at this point?
Well, there's quite a few items that we can use it for. It's specifically in the legislation directed to be used for COVID-19 response. So that is how much of the guidance has come out of Treasury to how we can spend it. So we can spend it for delivering health care to individuals. We also have been able to use it to pay employees or individuals or other entities that are delivering that kind of response. But I will say, Lee, too, that the guidance is changing quite often. Treasury keeps giving out more pages of guidance and direction on how they want those dollars spent, and so that is what our Bureau of Finance and Management and Department of Revenue are working on, is making sure we're staying up to date and have clear direction on how those dollars should be utilized.
Does that moving target make it, I guess, really hard for the state to respond with this? And are we kind of, we're running out of money to respond to this at all?
No, I would say that we're utilizing our resources that we currently have. We live in a state that has always balanced its budget. We have money in reserves and rainy day funds, and so we are going to take care of people and then make sure that we're making wise decisions in the future as to how we deal with future budgets. So we are doing well today, but we also need to plan for tomorrow and make sure that we have the revenues in place to take care of people.
Governor Mike Tanner at KWAT.
Yep, go ahead, Mike.
Hi, Governor. This question might be a little premature given the fact that you don't know how deep the budget hole is going to be yet, but I'm just wondering what your thoughts would be on employee cuts, cutbacks, or raising taxes versus dipping into the state's rainy day fund when it comes to trying to balance the budget.
Well, I haven't had in-depth conversations yet with legislators on those issues because we haven't gotten a clear picture of what our sales tax receipts look like and what's going to be coming in the door and how hard we were hit. So, those things could be on that list, but right now, I think we can tighten our belts, make sure we're spending our money wisely. We know there are some federal resources there, and as we get a clearer picture next month or in the next 6 weeks, we'll be able to make better decisions.
And a quick follow-up to that, what is your definition of what the rainy day fund is for, and would now, given the circumstances of what's happening, would now be a time to use at least some of it?
I wouldn't really have a great answer for that today, Mike. I know that that's why the rainy day fund is there, is for unforeseen circumstances, and this is certainly one of those situations. So I wouldn't take it off the table at this point, but my hope is that we could leave it intact.
Thank you.
This is Trevor Mitchell with the Argus Leader.
Okay, we'll go to Trevor, and then we'll go to Bob in the room.
Governor, or possibly Secretary of Health, is the state doing anything specifically with Good Samaritan in Sioux Falls, where 15 people have been reported to have died in connection? Are you taking any action similar to Smithfield, working with staff there, trying to figure out some of what the practices going on are there?
Sure, Trevor. This is Kim Malsom-Risden. So we have been working very intently with the folks at Good Sam. They did mass testing of their employees and residents here over the last week, and so they were very proactive in getting that done so that they could assess the situation at hand. We have daily calls with the team there. We're working with them on infection control and making sure that they have what they need in terms of guidance. And we're very confident in those practices at Good Sam. They've been excellent to work with and are taking it obviously very seriously. One of the things that they've also been doing is cohorting their patients so that they're trying to minimize the spread of COVID. And so we feel like they are doing very good work in that area. This is obviously a disease that impacts populations that live in long-term care settings very much, and so it's very, very hard to contain, but we're confident in the response that Good Sam has had up to this point.
As a follow-up, how have you, looking at nursing homes across the state, yesterday you spoke about unannounced reviews of some of those practices. I guess as a whole on the state, what are some of those reviews showing?
They're actually showing very good practice across the state, and one thing to mention is that most people don't like the thought of state inspectors coming in unannounced, checking them out. we have been met with open arms. People have been extremely receptive to wanting that review because people want to do the right thing, and I can't stress that enough about our long-term care facilities across the state. We've met absolutely no resistance, and what we've seen is very good practice, good use of PPE, good infection control, good disinfection of surfaces and the environment. So we couldn't be more pleased so far, and expect that, to see those kinds of results as we continue to work with long-term care facilities and assisted living facilities in our state.
Thank you.
Governor, two quick questions.
Sure.
One is, what role would the National Guard air support units do? And then secondly, in your discussion with legislators last night, was there any indication of any discussion, I should say, of a special session?
Yeah, we did talk about the potential for a special session, and I told them that I didn't have very clear guidance on if we would need one and when that would be. I think originally the thought and conversation has been around having a special session in June, and I'm not sure that's necessary at this point in time. If we do have the ability through Treasury guidance to utilize some of the federal funds, we may want to come back later towards September and make some decisions on what we can do to utilize those funds better and refurbish some of the dollars that we may have in other accounts. So that's the question that we need to find out from Treasury when they finalize their guidance to us on how we can use the dollars that they're sending to us. And the legislators' input into that was very helpful. As far as how the air teams with the National Guard would be utilized, is they are medical transport teams. So they will be conducting EMS type responsibilities across the state of South Dakota. The ground ones would be helping us get patients back and forth to different locations. The air ones, we've had conversations that they would probably be utilized to bring patients in from remote areas. So areas that they needed to move a patient quickly and could get them up off the ground in a remote area and get them to a hospital to get extended care.
So they would actually fly the patients?
Yes, that is what they're trained to do, and that's part of the duties that we anticipate that could be necessary and that they're prepared to do for us.
Thanks.
Questions on the...
Governor?
Oh, go ahead. So I didn't understand who was on the phone, but...
This is Morgan at the Rapid City Journal.
Sure, go ahead, Morgan.
Maybe Kim might be able to help answer this too, but how many people are enrolled in the hydroxychloroquine trial so far, or I guess how many patients have taken it so far too?
Morgan, I don't have a definite number in front of me. The last number that I had from a few days ago was about 270 individuals. That would include some folks on an inpatient and an outpatient basis, and including in some other states, primarily through the Sanford network, and in terms of those states that they serve as well.
Was that maybe a number you're expecting to see so far, or do you think maybe enrollment has been impacted by FDA warnings against the drug for heart problems or potential fatalities?
I think the numbers are low because we just don't have as many people that are being impacted by COVID, which is a great problem to have. So, you'll remember that this was geared towards people that were hospitalized primarily, as well as positive cases on an outpatient basis.
Thank you.
Was there another question on the phone?
Yes, Governor.
Yep, go ahead.
I was wondering if you've heard from Smithfield as far as the reopening, what the conversation with them has been this week.
Yes, they, I think, intend to put out some information soon as to what their phased-in approach to getting back to full production would be. So their company will be releasing information shortly. But they do have people in the facility now, and they will continue to phase in different areas of the plant throughout the next this week, and hopefully be to full production sometime next week. But those are great details to be asking them and their management team. Any further questions? Okay, thanks everybody.